Hi, today we'll be going over the squat. For a squat, it's essentially just sitting into a chair, changing your mind, and then coming back up again. So what it looks like is like this. Everyone's squat might look slightly different. This is because of differences in body composition. It can be that you have a longer lower body. Some people have a longer upper body. So there's lots of different ways to do a squat. When you're doing a squat, you want to essentially have two hinges happening at your hips and at your knees. When that's happening, you can drop your bum down as if sitting into a chair, and then you push back up again. Now, with the distribution of your weight, it will change which muscle groups are used more. When I do a squat and I bring my knees over my toes a lot more, having a lot more action happening around the knees, that will emphasize my quadriceps lots more, so the front of my thighs. If I were to sit back and my knees relative to my toes stay back, in that case, I'm emphasizing a lot more bend around my hip and my glutes will take the grunt of the work. When I'm doing a squat, whether I'm doing a wide one, a medium stance, or a really narrow stance, again, will mostly just change the focus of the muscle group in question. So for most people, I just say kind of stomp around, maybe go around shoulder width apart, and find your comfortable stance. But again, people have different preferences, and depending on what kind of weight you're lifting, you might prefer different stances as well. Now with the feet, some people prefer pointing their feet outward. This, for again, some people allows more glute activation. However, there's nothing wrong if you want to point your feet forward. One thing that's noted lots with a squat is that people don't want to see your knees come in. Now, there's nothing inherently wrong with that. Previously, there was a lot of thought of knees coming in, meaning that you're putting your knees at risk or that you're more injury prone. It does put you in a weaker position to not use your glutes as much. So I would prefer to have you push your knees out to give you essentially a stronger advantage when lifting the weight. If you're new to squatting or you're uncomfortable with it for whatever reason, perhaps you have an injury that you're recovering from, then you can use a surface to squat against. This will give you a reference point to tap your bum against, especially if you're worried about your balance, for example, or otherwise you're in pain and you're just like afraid of falling back. This can be a really great way to give yourself a reference point to tap against. For the goblet squat, I suggest using a kettlebell. You can use a dumbbell or any kind of other weight, and you ideally want to hold it right in front of your chest like this. Then you perform the squat as you normally would.